Hi, I'm Dr. Nick. I'm the incrementalist here with incremental insights for better business, better health.
And I'm Fred Goldstein with Accountable Health, and we're here working with Nick and others to help companies reopen and operate safely during the COVID pandemic.
So, Fred, 30th episode. It's extraordinary to think that we've gone that many episodes talking about this stuff. And I would say pretty exciting news with the Nobel Prize awards that are coming out, but one that's specifically kind of relevant to what's going on with the COVID-19 pandemic. Tell us about that.
Yeah, absolutely. So Dr. Jennifer Doudna and Dr. Charpentier won the Nobel Prize in Chemistry for their work around CRISPR. And CRISPR was this technique to take a sequence of RNA and to use a protein and match up to that sequence and find it. And then using a protein called Cas9, they would then cut or can create a cut at a certain point and do all sorts of things with it, which is really a technology that's exploding right now. She decided early on, Dr. Doudna decided early on in the COVID pandemic to go ahead and begin to convert her lab and figure out how to use CRISPR and apply it to the issue of the SARS-CoV-2 virus. And what she has now developed and has come out and claimed that it's working very well is a CRISPR approach to rapidly identify infection and within 5 minutes to have a result. And the way it works is it takes that sequence and it identifies a sequence on the RNA from the virus that matches, and it marches up the virus and finds that essentially, and then once it's found that, the Cas9 protein then cuts the nearest RNA, which creates a fluorescence. And they can detect down to about 100 viral particles per milliliter with this approach, which is not down to the level of PCR, but really good. And so it looks like a fascinating application, again, of this great technology that won the Nobel Prize to COVID-19. And as we've talked about, it's 30 weeks out. We've been doing this. And we're seeing all sorts of transformative things as we learn more and more about the virus. So it was really exciting to see it.
So it's just interesting to me that, first of all, they pivoted the whole lab. This technology has just completely revolutionized medicine in general, because now suddenly we've got the capacity to sequence. This was, absolutely complicit in the drive down of cost of sequencing, the speed of sequencing. And importantly, one of the things that you're sort of describing, and I know there's, potentially a lot of negativity around this, but this is genetic editing, but it's done in a way that says, well, we found this section, we're going to identify it, and then we're going to turn it into a test that works, as you rightly describe. And this is just incredible. It's, the adjacent possible of science and bench activity to turn it into a bench test at the point of testing. So there's no requirement to send it off to a lab, all the costs associated. So one, really cheap, really quick. That's extraordinary. So in terms of the toolbox, our toolbox just got filled with something really cool, right?
Absolutely. And as we think about testing, and you've talked about it quite a bit, is if we can move to a more rapid, direct point of care test, changes everything. So you were going to discuss further some issues with testing. What are we seeing there? What are you looking at?
Well, so I think from a business standpoint, we're now at the point, I think hopefully people are realizing we've got to test. You don't not test because then you don't find anything and suddenly our numbers are down. That's just, it's preposterous. We have to test. It's a central concept. But what do you do as a business? Do you test all of your employees? Do you test people coming back? And, we've worked with a number of organizations, particularly educational facilities. And at the time that we were advising, some weeks, months back, the push at the time was, don't test college students coming back. And I think we took the position that that really wasn't a smart move. I've seen, it's interesting, this Swiss cheese or funnel that reduces risk. And this is one of the things that reduces risk. And you want to test people before they show up. I think the test that you were talking about with the CRISPR that's at the point of care, you can do that, but if you can test beforehand. So how you think about this is complex, has to take account of local risk. So what's the current prevailing rate That will also impact the sensitivity and specificity, because depending on where people are and how much prevalence of the disease there is will determine the accuracy of the test, as well as the actual accuracy of the test. And then what kind of testing? So we know that we've got antigen tests are emerging, that test for the little spiky protein that pokes out. But then we have this PCR, as you described, Fred, very sensitive, but it has a different profile in terms of when it shows positive. So which do you pick? Do you know the answer, Fred?
No, I leave that to you experts in the medical field.
But I don't think we know unless we have the full context. And that's why individuals, businesses, educational facilities cannot do this on their own. This requires deep thought and understanding of the context of the capabilities of the test, your circumstances, and the risk profile of your employees, your students, your visitors, and your geography.
And isn't this something really, as we're talking about this in some of the universities we work with as well as businesses, universities are looking at what they're going to do this spring. How do you reopen now? We've learned a lot, so there are differences, and that's what you're getting at, why we should be looking at this and bringing in outside folks to talk about it and understand it better.
That's exactly right. So, I've been asked a number of times, what are you doing and what are other people doing? And I think the general position for many folks, especially as they think about spring, is, holy smokes, we only just got through, the fall and all the challenges. Do we really have to? And the answer is yes. The earlier you plan, the earlier you start thinking about this, the better prepared you are, and the more options you can create, because guess what? There's going to be some kind of a curveball inevitably thrown at us in terms of the virus or the way that people are reacting. We've got this whole concept, that is different to this R0, this K or spreadability, that I think people are starting to understand. And we'll probably talk some more about that in a future episode. But suffice to say, now's the time. Start thinking about this, planning appropriately. We've got the resources. We've got fantastic progress from this incredible Nobel Prize winning team who said, wow, we've got this technology. I wonder what we could do to help, like so many others. And wow, they have made some incredible progress concurrent with getting the Nobel Prize, which, you got to say, wow.
Absolutely. As a UC Berkeley alum, it's great to see Dr. Doudna as a UC Berkeley faculty member get this along with Dr. Charpentier. It's really great stuff. And I'm just wondering, Nick, if you could comment on this issue of, we've seen schools reopen. Some have students with face-to-face classes, but many chose not to. Is there going to be a better possibility to do that in the spring if you're thinking through it more thoughtfully?
Well, again, I think this, reduction of risk and the way that you approach this, if you start to be able to identify people quickly, early, rapidly that are at risk of spreading the disease, and also understanding the spread. So we don't think that it is you have the disease and therefore you will spread it, this R0 number, but there's some complexity in there. And we've heard a little bit about this with super spreading events. So taking all of that context, I think, is going to change the way that we start to manage that. Plus all the other things with face coverings, physical distancing, and importantly in the indoor setting, all the ventilation and insights around that we can change effectively, that essentially reduces risk down to levels that are entirely acceptable.
Well, fantastic. A great week 30. Got into CRISPR, Nobel Prizes, testing, opening universities and other businesses, and new ways to begin to look at how we go forward. So thanks so much, Nick.
And the one thing I would add is this is also the week that the Starman went past Mars. The Tesla finally made it, right?
And one of our other things that we're interested in, obviously, is space. So this is Fred Goldstein with Accountable Health. Thanks so much for joining us this week.
And this is Dr. Nick. I'm the Incrementalist here with Incremental Insights for better business, better health.